So in this video, I'm going to be talking about child health. So health is defined as a state of complete physical, mental, and social well-being and not merely the absence of disease. So specifically, I'm going to focus on infant mortality. Infant mortality can be determined by the number of infant deaths divided by live births multiplied by 1,000. And these are deaths of an infant before his or her first birthday. And as you can see by the graph of the United States, that the South has a higher rate of infant mortality, which is going to tell us a lot about how well an area is doing. Just based off the infant mortality rate, you can determine pretty much the income level of the state, the access to healthcare, access to nutritional food. So infant mortality can tell us a lot about how a state or area is doing. So some factors that influence infant mortality is access to healthcare, environmental factors, race, education, nutrition, stress level. And in the next few slides, we're going to go over in depth some of these factors. So the first one is access to healthcare. People that live in poverty have less access to health professionals due to insurance and inability to travel. Insurance in the United States is privately paid for, which for people in poverty, usually these jobs do not have benefits included in them, so they have to pay for insurance out of pocket, which can be very expensive. And the inability to travel to doctors also makes it difficult for people to get to the doctors because they can't afford to take off time of work because they rely on that money to pay the bills. And as you can see on the graph, the United States has a much higher infant mortality rate compared to other developed nations. And this may be due to the fact that other developed nations have universal health care versus relying on the individual to pay for the health care. So the next factor is race. Historically, non-Hispanic blacks have a higher rate of mortality compared to other races. So as you can see, non-Hispanic blacks have an infant mortality rate of 11.4, whereas non-Hispanic whites have 4.9 infant mortality rate. And there are a number of factors that also influence this number, such as non-Hispanic blacks typically are found to live in poverty. They have less education, and they are stressed by different factors such as racial discrimination in the workforce, which can cause financial stressors. So the next one is education. The second leading cause of infant death is sudden infant death syndrome, which is a lack. So this can be caused by such a lack of education, such as putting a baby on his or her back before bed or taking blankets out of the crib to help decrease the number of suffocation deaths. So when people are uneducated of these things, these factors can really influence the infant mortality rate in areas that generally have low education. So the child mortality by income level of the country, so it's found that the lower the income rate, the higher the infant mortality compared to the high income rate, the lower the mortality rate. So as you can see, typically countries of high income have higher education levels versus countries of low income typically have lower education levels. And even though this looks at the macro level of a country, this pattern is similar for a statewide area. It can be applied to all the different levels of microscope. The next factor is nutrition. So those in lower socioeconomic areas have a worse nutrition due to the lack of access to healthy foods, which impacts the baby's health. So for the United States on the right, this is showing the distance of big grocery stores. And as you can see in the South, the grocery stores are farther apart because of the darker color. So it's about 18 to 41 miles for the closest grocery store. And this directly correlates with the graph on the left of the United States showing the infant mortality rate. So you can assume that the lower access to nutritional food really does impact the infant mortality rate. So the next factor is stress level. So increased stress level can cause premature birth. Children that are born early usually have low birth weights, which is actually the leading cause of infant death. So one interesting fact about stress level is that when a mother is stressed, it does not just affect the mother and the baby, but it also affects the baby's reproductive organs, which can lead to this domino effect of premature birth. And one relation I thought was really interesting was talking about slavery and why non-Hispanic blacks have a higher infant mortality rate. Slavery was a very stressful time, so it just kept impacting the non-Hispanic black race. And even today, the stressors of racial discrimination and the hardships that non-Hispanic blacks go through can really keep increasing these premature birth rates. And also the financial stressors of living in poverty, which is where these rates are higher, can impact the premature birth. So as you can see that the leading causes of infant mortality is premature and low birth weights. And so here are my sources, but in short, infant mortality can tell us about the area's poverty level, the access to health care, how healthy the adults are, and how the society as a whole can fix these problems is not just a simple solution, such as education, because the main root of it is this cyclical event of people in poverty just continue to lack the resources needed to stop or decrease the infant mortality rate in the area.